providing resources and comfort to caregivers. This is Caregiver Crossing.
Good morning, everyone. Welcome to Caregiver Crossing. I'm Tina McIntosh in studio with
Noah Taylor.
I just wanted to see if you were awake over there.
I'm kind of falling asleep a little
You came in
today.
big right there.
I am so excited today.
He's totally lying. We both came in and we were like, we're so just meh today. So something about being with you all makes us happy.
Yeah.
Yeah. So thanks. I'm glad you're here. If it's your first time, you might want to know that Caregiver Crossing is a show brought to you by Joy's House, presented in partnership with Cardon and Associates. And we are here every week, right here on this show that you're listening to from the Joy's House studio to talk about all things caregiving. And we want you to know that sometimes we talk about really serious topics and sometimes we just want to laugh and be lighthearted.
It's okay to smile. It's okay to laugh.
Yeah. And reminisce and do all the good things. And so today we have a special guest with us and we're going to jump right into things. And her name is Wendy Rovet, and she is a client care advocate at Dillman and Owens Estate and Elder Law. And Wendy has more than 25 years of experience in healthcare and senior housing. She helps families find clarity and peace of mind through life care planning. And we're going to talk about that life care planning. And she's been in the room for really tough decisions, hospital discharges, family disagreements. She's had her own experiences, it sounds like, and she knows how to guide people through all of it with compassion and confidence. And we're really glad to have her here. So Wendy, thank you for being here.
Thank you for having me.
Not
I'm
a problem.
excited.
We're thrilled. Life care planning, I hear that, and it is a term that most people aren't familiar with. And so if Noah and I were kindergartners, which might be how we feel this morning, how would you describe what life care planning is?
Life care planning is essentially advocacy, it's guidance, it's legal intelligence or legal information. We also work with benefits. When people young or older need care, that has to be paid for a certain way. So we work with that. Resources. People, whether it's with aging or children, are always in situations where they don't always know what direction they're going. So we're there to give them guidance, give them options, different things like that. We also strategize. We do a lot of exclusive content for our clients, just there to help them down the path of life, so to speak.
And is there a typical person or a typical family unit that you can think that uses this? Like, for instance, would it be I'm pre-planning with my husband, or would it be I am suddenly caring for my mother? Could it be both?
Definitely could be both. That's for sure. A lot of times people will start with us with the pre-planning, which is more estate planning. That's just kind of getting your documents in place, looking at which of your adult children are going to be involved, as far as like a power of attorney, a healthcare representative. Also looking at things like how is your future care going to be paid for? And then we do a lot of crisis planning.
Yeah.
So it seems like your team really does a lot. I'm wondering, how involved are you in like the medical side of care with doctor appointments and maybe medication changes?
So a lot of that just depends on kind of what the family and what the client themselves needs. Navigating the healthcare world. I like, for example, I had a client, she essentially had pneumonia and was 2 weeks out from a doctor's appointment, and we were working with her with some legal documents, and I was there having her sign them one day, and I'm just like, okay, we need to either go to a walk-in clinic or we need to go to the ER because you're short of breath, having trouble breathing, those sort of situations. So it ranges from a kind of a crisis right there to somebody's not happy with a primary care physician. They're not really getting the support they need. That can happen a lot with dementia and things like that. Then we'll, give them guidance with that. We'll certainly go to doctor's appointments. Maybe the adult child is in Florida for a couple months and there's a key appointment coming up, cardiology appointment or something. We'll go with that. We attend care plans in facilities, just lots of different advocacy there.
This feels different than a lot of law firms.
Yeah, I think the client care advocacy is a big part of it. So my background, as you had mentioned, is healthcare, senior housing, all of that sort of thing. One of my coworkers was a nursing facility administrator for 30 years. So we just bring a lot of expertise. But, we're trying to find the balance, between the provider, whether it's the nursing facility, the assisted living, the home health, and what the client and the family's needs are, and sometimes they get a little,
Yeah.
but we've seen both sides of it. So, the bottom line is we want a client that's happy and well cared for. So we're going to make that happen.
You are hearing the voice of Wendy Rovet, who is a client care advocate with Dillman and Owens, and they are an estate and elder law firm. And what we're talking about is life care planning, and it is unique. I think what I'm hearing you say is you're almost combining medical concierge services with geriatric consultant, in a lot of ways, with the legal. I liked it. You said earlier, legal intelligence and information.
Right.
It's just not what most of us have. We're not ready for that. I think a lot of families just feel like, listen, Wendy, that's great. I'm just trying to get through the day.
Right.
I'm just trying to make it work, and
Right.
so are there any signs of, but this is the time to make the phone call to make this happen, to go into life care planning, with your firm there at Dillman and Owen?
A whole lot of alternatives. I can say that we have a client right now that has an emancipated adult child who's got some mental deficits, and there's a son that lives in Georgia, and they are doing pre-planning right now, and then they want us to be their client care advocates down the road. They know their daughter can't do it. Their son lives far away. So they've hired us to help them. We understand what their wishes are. I'm their client care advocate, but they also want us to take care of their daughter when they're no longer able to, and be her client care advocate as well. So,
Yeah, and I think that leads to a great thing, that there's a lot of talk about this being for older adults, but life care planning is really helpful even when, there's a younger person involved with maybe a serious health issue or a disability. And so we're going to have to take a break. When we come back, I want to talk about a number of things. I know one of them is cost.
okay.
Cost and how people can get a hold of you there at Dillman and Owens. And I know Noah's got a bunch of other questions prepared too.
I've
So,
got all types of questions.
well, we're going to take a break. And Noah's going to tell you how you can listen to past segments.
You can find past episodes of the show at joycehouse.org, and be sure to like and follow us on Facebook. Our account is Caregiver Crossing. I'd love for you to send us a message. If you would like to connect with us or to discuss show topics, need help connecting with resources, have a question that you'd like for us to answer on air, or just want to say hey, you can reach us at 317-254-0828. Now you're listening to Caregiver Crossing, a show designed for family caregivers and the people who love them. Caregiver Crossing is brought to you by Joyce House in partnership with Cardon and Associates. With 20 communities owned, operated, or managed in the Midwest and more than 40 years of senior living experience, Cardon and Associates provides residents with the best senior living options and personalized service. Visit cardon.us for more information and to find a community near you. All right, stay put. We'll be right back with more Caregiver Crossing right after the break.
We came back on air. I just want you to know that Noah told me I was right about
did.
something.
I said it twice, actually.
Now you're being nice. I was like, repeat that. And he was like, no. Hi, everybody. We're back here on Caregiver Crossing. I am Tina McIntosh in studio with Noah Taylor. And we are joined by Wendy Rovet, who is a wealth of information. She has a lot of history in healthcare and is currently a client care advocate. I don't feel like I want to say that 5 times fast. A client care advocate at Dillman and Owens Estate and Elder Law. And thanks for sticking around with us.
Sure thing. Thank you for having me.
So we're talking about life care planning, and it's a unique concept. It's something I've known that your law firm does for quite some time, and I really appreciate it because, let's be honest, when we're caregiving, we're just doing the best we can.
Right.
And we don't know everything.
Right.
And I tell caregivers all the time, listen, it is good for you to study up on the things, the diagnosis, the how-tos, all the things, and yet you don't need a doctorate.
Right.
And part of that reason is because there are good people like you and the rest of you in your law firm who can help fill in those gaps, right?
Yes.
And so let's give a scenario to her, Noah. Would you like to give her the scenario, or do you want me to do that?
Oh yeah, I'd love to. So let's just say somebody in their family found out that their dad can't return home after a fall. What's the first step that you take with that family and their loved one?
Right. So just want to understand kind of what the goals are. Is it a couple? Is it just an individual? Maybe their spouse has passed away. Is their goal to stay together? What is the level of care they were at prior to this experience? Where are they at now? Is it like, for example, if somebody had a stroke, that can be kind of a long healing process. And what we see right now isn't necessarily where someone will end up. So maybe we need kind of a stopgap to, what a long range goal is, but just kind of understanding what people's priorities are. Unfortunately, sometimes finances are a part of things, understanding their insurance, just what kind of family support they have, and just all of those sorts of things. But just kind of assessing the situation, getting to know people and what their goals are.
Okay, but that's brilliant right there, because listen, I went through this a couple years ago with my biological father, and he couldn't go back home. I literally, without realizing I was going to have to do it on the day that it happened, packed him into my vehicle from he had a fall. He was in physical rehabilitation, had lived in assisted living.
Yeah.
And I went to visit him, and they said, he can't stay here.
Yeah.
I was like, what do you mean he can't stay here?
Yeah.
I literally had to pack him up and bring him back to a hospital here in Indy.
Right.
I wouldn't know it's a crisis.
Right.
I'm just doing what I needed to do to get by.
Yes.
So the fact that you are like, what is the goal is important. If somebody had asked me that question, I would say our goal is to bring him here to die.
Right.
Truly.
Right.
That was his wish, our wish, everyone's wish.
Right.
But instead, everybody was so interested in him rehabbing and finding another place to live. And I was like, he's done.
Yeah. Exactly. So I also have a 14 years experience in hospice.
Yes.
Did hospice education. So just part of that, where, a lot of why I do this is to help people down a path. It's not always a path people want to go, but it's not a path you can always stop. So, if your goal was to bring him home to die, then, how are we going to make that happen? Or is he still at a point where he's not ready for that? Or you and he understand it, but a brother does not understand that.
Yes.
And maybe the brother doesn't see dad on a regular basis, that sort of thing. So just helping people deal with the emotional aspect of all of this, I think really is 100% why I do this. The person who is told that they can't ever go home again, what kind of grief and loss comes into play with that. And
thank you for understanding that. Not everybody understands that. And so you're hearing the voice of Wendy Rovet, and she is a client care advocate with Dillman and Owens estate and elder law. And so, a lot of people, and I just look at that situation with my own father, Wendy, and we were scared of making the wrong decision. And so do you come alongside people and help them to be confident in their decisions as well?
Absolutely, 100%. In all of my 28 years, probably the thing I've learned the most is to advise people to trust their instincts. You know this person the best, you love this person the most in the world, and you really are making the right decision. And, you're, like you said, you're just somebody there to walk alongside and support and make them feel better about that.
I think so often a lot of people, like maybe their circumstance changes. Myself, my brother was in hospice for a few weeks, and then one day he just got up and felt a lot better and was able to leave.
Right.
So do you stay involved long-term with the clients?
Right. I think that's one of the biggest beauties of life care planning is adapting to situations changing, whether that's health-wise, which is an example that you just stated. And that happens. People graduate from hospice. I don't think everybody realizes that. But it also can happen financially. We had a client that came in to work on getting Medicaid for their husband, but their husband was put on hospice shortly. So that wasn't the focus anymore. The focus changed to estate planning and things like that for her. So, and because we do an annual review with the attorney, life changes in a year. It changes every single year. So we just kind of look over everything. And then we also have it's like having access to an attorney 365 days a year too. That's another. We haven't talked a lot about the attorneys.
Well, I was going to say, so what's the
portion.
cost? Because, you say attorney and I'm instantly like, oh, it's a lot of money every 15 minutes. I mean, you're like, what is the cost to
Right.
this life care planning?
We have a flat fee that we do. And like, for example, if someone was going to need to apply for Medicaid, that's $7,500 to accomplish that goal. Life care planning itself is $9,500. So it really, for that, it is a difference in money, but then you get the client care advocate and all of our years of experience. Like I said, you get the attorney on call like 365 days a year for any questions that you have. The advocacy. We also, with so many of our clients being elderly, signing documents and things like that, they can't come to the office. So we go to them. We'll take our laptop and, we'll do Zooms with the attorney, that sort of thing. So, just all of that and, the benefits and all of that sort of thing. So,
I mean, that sounds incredible to me. You said it's $7,500 for the Medicaid to, the package, which is very complicated, and $9,500 for the life care planning. Is that
Right.
annually?
No, the $9,500 is a flat fee, and then if people choose to renew with us, it just varies whether it's single or couple.
Okay.
So there can be a smaller renewal fee.
Okay. I mean, if I had it, I would do it. If
Right.
you know what I mean, we're at that place. And so how do people get a hold of you?
I can be reached at 872-250-6196. And then I will pass people on to, whether it's our intake department or, whoever they need to speak with.
Yeah. Is there a website too?
Dillman, Dillman-Owen.com.
Dillman-Owen. And I know I said Owens earlier, and I apologize for that. Dillman, Dillman-Owen.com. And so if you want to learn more about the life care planning for sure, if there's anything you want to know regarding legal, Medicaid applications, anything like that, give
Right.
Wendy and her team a call. Again, Dillman-Owen.com. Thank you for taking the time to be here.
Thank you for having us, and thank you for discussing the topic. I
Yeah,
think
and
it's
for the work
important.
you do, by the way. I mean,
Thank you.
important work, the work you've done for 28 years and the work you're doing now. So thank you.
Thank you.
Thank you so much.
Are we done? Are we leaving?
I think we gotta go. You're listening to Caregiver Crossing, a show designed for family caregivers and the people who love them. Caregiver Crossing is brought to you as a service of Joyce House in partnership with Cardon and Associates. With locations in Broad Ripple and near the University of Indianapolis campus, Joyce House provides exceptional day services for individuals living with a life-altering diagnosis and compassionate support for family caregivers throughout the community. At Joyce House, we believe that everyone deserves to live their best life, regardless of their abilities. Learn more about our adult day and caregiver support services by calling us at 317-254-0828 or by visiting joycehouse.org today. All right, stick around. We'll be back with more Caregiver Crossing shortly.
Welcome back to Caregiver Crossing. I'm Tina McIntosh, and I've been able to get Noah Taylor to stick around with us today.
I'm staying here.
I'm so glad. We're joined today. Thank you, by the way, for all of you being here. And we are joined today by Holly Helm, who is from CenterWell. And she serves as a trusted partner to families navigating this world of senior health care, which, let's be honest, we all know that is a lot. And so Holly works across Southern Indiana and in the Louisville area to help older adults receive the thoughtful and coordinated care that they want, sometimes don't know that they need, and that they all deserve. And so with a focus on senior-focused primary care, she and her team are helping caregivers to feel more supported and more informed every step of the way. So Holly, thank you so much for being here with us.
Thanks so much for having me, and a special shout out and thank you to the caregivers of the world. That is a tough job. It's a thankless job, and you're not unseen. And I'm just so thankful to be here today.
That's really sweet of you. And, we've been talking a lot about that too here, is that people just want to be seen.
Yes. Just
Seen.
want to be seen,
Heard, like utilized, fulfilled and giving. And so really appreciate you. But when you said that, shout out to the caregivers, Noah and I looked at each other like, yep, she's our people.
Yes.
She gets it. So Holly, when we talk about, in the introduction, we talked about senior focused primary care. What does that really, what is that? I guess senior focused primary care. What does that really mean and look like in the practice at CenterWell?
Yeah, I really liken that to like a pediatrician. So if you have children, you send your children to a pediatrician for child's needs for a primary care provider, and we're all expected to kind of go to an adult doctor when we turn 18, right? And so in the old way, you'd see the same doctor from 18 to death. But what we do is we do primary care that's just for seniors. And so it's kind of like a pediatrician, just the other way around. The question really is, why is it needed? And so to answer that, seniors just have a different list of conditions. Right now, 70% of seniors have at least 2 chronic conditions, and more than a third have 4 or more chronic conditions. So those needs just require a higher touch, more coordinated approach that a typical doctor's office is just not equipped to provide them.
And what age are we talking when we talk about seniors? What is that age at CenterWell?
Typically we say 65 because at CenterWell, we take only Medicare recipients. However, we don't have an age requirement. So while most folks get Medicare when they turn 65 years old, you can also qualify for Medicare due to disability. So we don't have an age requirement. We do see patients that are in their 20s and 30s. It's super unfortunate, but those are also folks that need just a higher touch approach to their healthcare.
And Medicare, for those who might not be as familiar, Medicare means what in simple terms?
So Medicare is the health insurance that you receive from the federal government, typically when you turn 65.
Okay. Yeah. It's just hard. I mean, we talk about it a lot on the show, like Medicare and Medicaid, and I'm still, after 25 years, like, I don't know.
Which one's which?
They're both important. But so Medicare only at CenterWell. But CenterWell does have a different feel to it. When you walk in and you visit CenterWell, you can feel a difference. And so what is that from your perspective for both patients and caregivers? What's that difference?
Well, I'll paint a quick picture, but feel free, anybody that's listening that ever wants to pop in for a tour, that's actually something that we offer, so we can show you what's different before you make an appointment. But the one thing that people notice immediately, I think that this is such a strange thing to point out, but they always say it's so clean in here.
Yes.
But it's exceptionally well lit, clean. We have very big windows at all of our locations because we provide transportation. So we want to see those cars that we're looking for. They're almost exclusively next to a Kroger or some sort of pharmacy, so they're easy to find. But what you'll experience that's definitely different is we really have a short wait time. We try for about a 5-minute average wait time, which
Stop
is
it.
unheard of.
5 minutes?
I will not.
I mean, that is fantastic.
I mean, especially when you're a caregiver or an aging adult going through so many things. 5 minutes, that's...
I could hug you right now, Holly. I'm not 65 yet, but
yeah, I will.
can I pretend?
Believe me, I want to come here, but the wait time is minimal. And how we do that is we don't double book appointments. When I go to my doctor, which I just went and had my physical last week, my doctor is seeing somebody while there's 2 other people in 2 other appointment rooms and then 2 other people in the waiting room, right? They're really chugging through people, and we don't do it that way. I can't promise a 5-minute wait time, but on average it's less than 10 minutes for sure. So that's different. You'll also notice right away.
I'm so sorry. We'll take anything close to 5. I mean, at least you didn't say 50, so go ahead. You said You'll notice right away.
We've got like it's just very welcoming. Every one of our centers has a coffee and snack bar in the waiting area. So it's just a different feel.
Speaking my language
Um,
there. Food and drinks.
yeah.
Yeah.
Yeah, and each of our rooms, our actual appointment rooms, looks different because it doesn't have that big green table that you've got to hop onto. We have what's equivalent to a healthcare lazy boy. It's very comfortable. It lifts up, it lowers, it lays down only if you need it to. It's heated, very comfortable. So it's definitely got a different look to it. And most importantly, we don't rush you. Our average appointment time is 40 minutes long. So we want you to be extremely comfortable while you're here.
So it sounds like you guys do a lot of incredible things at CenterWell. When families are searching for the right provider, what signs should they look for that a practice truly understands older adults, like CenterWell?
There's a lot of things to look for when you're looking for a healthcare provider. Some of those things are just so obvious. You want somebody that's in your insurance network, that's close to home and convenient. But I think that's what's really important is to find out how quickly can I get into that provider if I'm sick. That's the real question. That's what you want to dig into, because you don't want to go to a healthcare provider where if you wake up and you think you might have the flu or your throat hurts, it takes 7 days to get in to be seen. You want to get in there within 2 days. That's super important. At CenterWell, if you call us in the morning and you're an established patient, you're sick, we are very likely getting you in same day. You call us at lunch, we're going to get you in the next day. Incredibly important. You also want to ask if that provider is available by phone during or after hours, right? Sometimes as a senior, maybe you've just gotten out of the hospital, you need to be seen right away by your PCP to go over your new medication or whatever happened to you. And you want to be able to sometimes just get answers over the phone and not have to go in, and sometimes you're physically not able to. So there's things like that you want to have answered before you select a PCP.
Incredible. Holly Helm with CenterWell. We're going to ask you to stick around. We're going to have to take a break, but we will be back in just a moment.
You're listening to Caregiver Crossing, a show designed for family caregivers and the people who love them. Caregiver Crossing is brought to you by Joyce House in partnership with Cardon and Associates. With 20 communities owned, operated, or managed in the Midwest and more than 4 decades of senior living experience, Cardon and Associates provides residents with the best senior living options and personalized service. Visit cardon.us for more information and to find a community near you. All right, stay put, everybody. We'll be right back with more Caregiver Crossing right after the break.
I'm Tina McIntosh in studio with Noah Taylor
Hello.
Here at the Joyce House studio. And on the phone with us, we have Holly Helm, who is with CenterWell. And if you missed the last segment, you got to go back and catch it on podcast, because she is just too good to be true with really great information. And we all wish we were 70 or 65 and had Medicare just so we could go to CenterWell. Want to talk about a few things. You do a lot of work personally. The company, is in a lot of places, but you, Holly, are in Southern Indiana and Louisville. And I want to know what you are seeing from caregivers that you think is overwhelming them most.
There's so many things, but to be really topical and current, right now we're really struggling with food insecurity more than ever. As a doctor's office that is really focused on preventative medicine and holistic health, that is something that matters a lot to us. So to manage that, we're hosting farmers markets and having great relationships with community partners, helping people navigate SNAP, but getting people fed. It sounds so elementary, but that's important to us right now. And then also we hear a lot of challenges from caregivers about how to navigate Medicare. You were talking earlier about how confusing that is. And for caregivers, it's extremely confusing. It's not their time yet. These things change annually. And so to that, I say find a great, trusted in-person broker in your area, someone you can get a hold of quickly and can guide you through that process unhurried. It's really important.
Isn't it interesting that most of the things that you're sharing that are touching like Noah and my hearts are the personal touches and again, going back to what you said at the top of last segment, being seen, individuals being seen. So whether at CenterWell, it's your, your coffee and snack area in the waiting room. It's the short waiting times. It's you don't rush people. It's those comfy chairs you're talking about.
Heated.
Like, right? I mean, it is really about like, I see you and we're kind of hugging you and embracing you everywhere where you are at CenterWell. And so it's the same thing with something like Medicare brokerage, like not sexy, but really important. And you want to find somebody like you're saying that will see you individually and take the time to care for you. So
Yes.
Holly, you've seen, I cannot even imagine how many caregiving journeys. And what is it right now that gives you hope about how we are caring for our loved ones?
Well, I have a lot of hope because things are just changing so quickly. CenterWell wasn't around in my market even 3 years ago. When my own grandmother, she went in the hospital with COVID, came out with Parkinson's,
Mm.
and that was a whole journey where my aunt had to step down at 58 from her job to take care of her mom full time. And, I wish that then she had the resources that I know about today. It's about connecting caregivers and our patients with resources, and those resources exist and they just keep getting better. So I look forward to aging because I guess because I live in this space. I just see it improving. I mean, my goodness, there's Margaritaville retirement centers now, right? Like we can all dream. It does keep improving.
Well, that's true. When I first started 25 years ago, somebody said, I don't want to be in a long-term care facility unless it's someplace that Mick Jagger would hang out. And I don't know if I don't know if Mick Jagger would be my personal choice, but I hear them
I
and
get
understand
that.
their words, So Holly,
Yeah.
we've got something special coming up at Joy's House that is, we're presenting in partnership with CenterWell. And I want to make sure that our listeners know we have an open house coming up, and it's an open house and hello. You don't have to stay for long unless you want to, but it is coming up here on June 25th, and it's from 5:30 to 7:30 p.m. at our Broader location in Indianapolis. And we would love for listeners, for you just to come and visit us, join us with our partners at CenterWell. Come in, drop in, say hi. We're going to have some folks from the Indianapolis Symphony Orchestra that are going to be with us. We're going to have some furry friends, right?
Oh yeah, therapy dogs.
We love our therapy dogs. We're going to have some little nibbies, as it has been said, from Chick-fil-A. We're going to have some ice cream from Bricks. We're going to have some activities you can do. You can learn more about what we're doing at Joy's House. You can learn more about CenterWell. And so we want to say thank you, Holly, to you and your team for partnering with us in so many special ways. And one of them is by providing this open house at Joy's House. So thank you for everything that you are doing with that.
Absolutely, our pleasure.
Now, if somebody wants to get in touch and they can't come to the open house, how can they get in contact with CenterWell?
You could go to CenterWell Senior Primary Care.com to find a location near you. Just Google us and call the nearest clinic, and we would be glad to get you in and show you around.
All right, that's CenterWellSeniorPrimary.com, or you can just go to a center near you. Now, any advice before we have to go here in just a couple minutes? Any advice on when somebody walks in? Because let's be honest, people are nervous to walk in to someplace new. And so any advice to somebody that's like, yeah, I do want to stop in, but I'm a little scared to do it?
Don't be nervous. In fact, we have this awesome activity room where people come in that aren't even our patients because we host all kinds of fun parties and events and fitness classes for the whole area. It's not just for our patients. So we are so used to people coming in off the street and just coming to join us for fun.
Okay, so walk in, introduce yourself, tell them you're there just to take a look around, that you heard Holly Helm on Caregiver Crossing talking about CenterWell and everything that they have to offer there. Holly, before we go, is there anything that you're like, here is my piece of advice for family caregivers, or something that I feel like I just want to say out loud?
Oh my goodness, you are not alone. You are not alone. Find your village. These open house and community resource fairs are just such great things to do, to know that you're not alone. Go connect with all those resources in your community to get help. They're out there. Maybe you don't see them on TV. They don't have the marketing dollars, but there is lots of help out there. So raise your hand, show up, and link arms with other people that can help you through this tough season.
That is perfect advice. I mean, we hear a lot of people say, I just don't have the community or I just don't have the resources. But I hear what you're saying, Holly. The resources are out there. Your community is just waiting for you. So get up, get out of the house, put a bra on, do whatever you got to do, get out of the house and go to the thing. I love that you said that, raise your hand and link arms. So, all right, Holly Helm, CenterWell, thank you so much for everything that you do. And if you want to know more, CenterWell Senior Primary.com, or just go to a location and tell them Holly Helm sent you and you heard her on Caregiver Crossing.
All right, as we close the show today, we'd just like to remind our listeners that they can contact us for more info and resources to help you through the journey of caregiving at 317-254-0828. Caregiver Crossing is supported by Cardon & Associates with 20 communities owned, operated, or managed in the Midwest and more than 40 years of senior living experience. Cardon & Associates provides residents with the best senior living options and personalized service. Until next time, you are not alone.